Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. Our program focuses each week on a different healthcare provider or service that we offer here at KRMC. I've got a great, interesting guest in the program today, so stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dana Bowers. She's an infectious diseases pharmacist here at KRMC. Did I get that right?
You did.
Okay. Thank you for being on the program today, Dana.
Thank you for having me.
We're going to talk about what that all means because I'm sure most people don't even have a clue what infectious diseases pharmacist does. So let's talk about that first.
Okay.
So you're a pharmacist, is that what your education degree is?
Yes, I graduated from pharmacy school.
Okay, and then you specialized in infectious diseases?
Correct. So I went to pharmacy school at Washington State University.
Okay.
And then after that, I did a general practice residency. And now for pharmacists, it's not required to do a residency like it is for physicians, so it's really optional. And so I did a general practice residency in Olympia, Washington. And then after that, I specialized in infectious diseases, which means that I moved to Houston, Texas, and I lived there for 2 years and did a fellowship in infectious diseases.
Oh, wow.
So I did some clinical rotations at St. Luke's Episcopal Hospital for a year, and then the second year I was at the University of Houston College of Pharmacy doing research. So I did different kinds of research. I did research on benchtop, so working with microbes in different petri dishes and things like that.
I was just going to say, so you spent a lot of time over a microscope?
So not necessarily, but we tested different antibiotic combinations with different bacteria, and then I also did some animal work, meaning that we did some experiments on rats and mice.
Okay, testing.
Yeah, just evaluating how antimicrobials would work in those animal models.
Okay.
So then hopefully we can translate in that into human use.
So when you say antimicrobial, is that like antibiotics, or is that what that is?
Yeah, so antimicrobial is the same as antibiotics.
Okay.
They're basically the same thing.
So it's new ways of treating diseases and illness kind of thing.
Right.
Other than over and above our what we know of antibiotics and new stuff?
Right. So currently there's a lot of antimicrobial resistance in the world, meaning that the current antibiotics that we have aren't as effective as they used to be.
And that's partly, from what I understand, that's kind of our fault as the patient not being real good at finishing our prescriptions, things like that, right? And they've kind of created this superbug.
So that's part of it. I mean, it's mostly the overuse of antibiotics, so using antibiotics in, let's say, viral infections. So if you have the flu, if you have the cold, those are caused by viruses. And often when you give antibiotics, they're not going to work because they don't treat viral infections.
Okay.
And so part of the problem is that we give antibiotics in those cases when they're not needed.
And what happens when you do that?
So a couple different things can happen. So normally in your body you have different bacteria that are all over the place, okay? You need them to survive.
Yeah, some are good, some aren't.
Right, some are good or some aren't. And so when you give antibiotics, they don't selectively kill off the bad ones, they kill the good ones too.
Right.
And so you can have some that develop resistance because you expose them to antibiotics. So you create a selective pressure, meaning that there's a subset of microbes that were resistant and you killed off all the other ones that were keeping those microbes in check. So now these ones are able to grow.
And they run rampant.
Yeah, so that's part of the problem.
Okay, and and that can lead to things like MRSA, right? I mean, is that, or maybe I'm on the wrong track with that, but how I know MRSA somehow is an infection that's common with people that have, and they're not resistant, or they're too resistant.
Right. So that's it's methicillin-resistant Staph aureus. So it's a form of Staph aureus, which is normally a skin bug, and so now it's resistant to certain antibiotics. And so that happened for a couple of different reasons, but one of the reasons was that we hit it with a lot of antibiotics, so then you created this resistant one, which is then spreading from person to person.
Wow. So once a person gets MRSA, I've heard they're kind of like it's always with them, basically. Is there a way to get rid of MRSA?
So if you have MRSA, you can be colonized with it, meaning that it's part of your, let's say it's on your skin or it's in your nose, our common sites of colonization. That doesn't mean that you necessarily have an infection with it. It just means that you have it on your skin. And people can be transiently colonized with it, meaning that they're colonized with it, then it goes away.
Okay.
So just because you that you were diagnosed with MRSA at one point doesn't mean that you will have MRSA again.
Okay.
But it depends on how long you're colonized for, and no one really knows exactly how long that is.
So it's kind of on a case-by-case basis. So what is the best, well, we'll start with, what's the best way to avoid that to begin with? Is there things that we as just a regular person can do to make sure they don't get MRSA?
I would just say washing your hands is probably the
good
best
hand
thing.
washing.
Yeah, is the best thing you can do really to prevent all sorts of infectious diseases. So that's really the best thing that you could do. Would just be wash your hands. You know, cover your cough. Don't touch your face a lot. Things like that.
Okay. And if you get MRSA, like you talked about, it can be dealt with. But what kind of things, if it's resistant to certain medications, then is that what you're working on, is finding new drugs that will kill it? I don't know.
So not specifically, that's not exactly what I did when I was in Houston. There are some treatments for that. So even though it's methicillin resistant, there are still other drugs that you can use to treat it. Yeah. So oftentimes it's still susceptible, meaning that vancomycin will still work for it. There's a couple other drugs, and there's actually some new drugs that were recently approved that can be used to treat it. So we're not completely out of treatments for that particular bug.
That's good, because I know MRSA has a bad connotation, and it's scary for people to hear, and I guess staph infections are kind of the same fear factor, if you would, for people when they come into a hospital. They're always concerned that they might get that infection. And I know that we do, as healthcare providers at KRMC, hand washing is a very important part of what we do with all of our staff. I mean, even I in PR know when I'm going to the hospital, wash your hands, and they have it in the cafeteria. We've got the antibacteria wash and that kind of stuff, so it's just really important to do that. It's kind of funny that the most simplest things that our grandmothers were
I know. We don't need to have all these drugs often. It's just preventing it by washing your hands.
Right. It's one of those simple but basic truths, right? Just do that. So it sounds like a pretty interesting field of study that you're in, that's kind of ongoing, probably changes all the time too. And what are you doing here at KRMC now, since you've moved here? We're not so much a research, but what is it that you're focusing on?
Right, so I'm creating an antimicrobial stewardship program, which basically I will be working with an infectious diseases physician and microbiology and infection preventionist, and we will be evaluating the use of antibiotics in the hospital. So we'll be making sure that they're used appropriately. So for example, if someone has a viral infection, just making sure that they're not used for that. And then we'll be following the resistance patterns of the microorganisms throughout the hospital. So that, say we're seeing, for example, MRSA. So let's say we're seeing an increase in MRSA over the last 3 months or something like that. Then we would focus on exactly where that's happening and how we can prevent that.
Like it's in a certain part of the hospital.
Right. We would see, evaluate what they're doing in that particular unit and seeing if there's anything that we can do to prevent the spread of that.
Okay, very good. So you've been here since August, I think you shared with me. So you're new to Kingman, you're getting settled in, and you're kind of getting to know the staff and everything. I know that, well, Dr. Jacon is the infectious diseases physician you're referring to, and Debbie DeMars, she's been on the program before. In fact, just last month, I think, we talked about hand washing then too, and importance of flu vaccines and things like that. So you're working with a great team.
Yeah, they seem really great.
Yeah, that's good. And you shared with me before the program, so I want to share with the audience now. So you and your husband are both in the medical field. So what does your hubby do?
Right, so we moved here because my husband's one of the first-year emergency medicine residents.
Oh, okay, so he's with Midwestern University and going through a residency training program. Cool. And that just worked out well, that we found a job for you too.
I know. We're just so blessed, that it worked out like that.
Excellent. And how did you meet?
We met in college, actually.
Okay, I kind of wondered if you might have.
Yeah, so we went to undergraduate together in Central Washington University, and we both met in organic chemistry of all places.
Oh.
So.
How romantic.
I know.
Very good. And so you're getting settled in Kingman, and it's different from Houston or Washington, obviously, but
For sure. Yeah.
that's cool. Now, I don't know that we've ever had an infectious diseases pharmacist before. I think it's a new position.
At the
isn't it?
hospital? Yeah,
It
it is. So there's not that many in the country. They're trying to push for more of it just because with the reimbursements to hospitals for certain conditions that are infectious, they want to bring an antimicrobial pharmacist in there just to evaluate that and see if we can improve that in any aspect.
Sure, because, well, part of it too, I mean, if someone gets MRSA or has MRSA and it delays their being discharged because they get sick from that, and it affects reimbursement, as you mentioned. But even from the patient standpoint, most people, their favorite place is not to hang out in the hospital.
Yeah.
It's like, fix me, get me out of here. I just want to be done. So you have to work real closely, I would think, with patients and physicians. So you're up on the floor a lot?
Yep, up on the floor, talking to people, answering any questions that they have.
Okay. And what kind of questions do you get?
Well, mostly it's about what antibiotics to use. So, for example, if they have a urinary tract infection that's resistant to some antibiotics and they have some allergies, I'll go in and ask the patient exactly what their reactions are to those antibiotics to make sure that we have one that will be good for them and work for their infection.
So you work closely, well, pharmacy is your kind of home base.
Right.
So you work real closely with them to check what we have for inventory. And what if we don't have it here? Then do you special order it from somewhere?
Well, I try to make sure that we could use something if we have it here. So, I mean, there are different alternatives. But if we did have to order something, we would just order it. We could get
Pretty quick.
Yeah, either from Phoenix or Las Vegas.
Yeah, things get down up or down here pretty quick. That's one of the nice things. We're kind of central to both locations, so it works well for all kinds of different things for us. So, other questions that you might get? What kind of things do you hear from patients that they're asking about?
Well, patients, I talk to their families too, and so they just don't understand, why patients are in isolation, meaning that if they have, let's say, MRSA that's been isolated, either, they have an infection with it or through, we do screening of the NERs, so the nose screens, and then they just don't understand, why they have to be in isolation, meaning that people have to put on the gowns and gloves before going in there, people visiting, things like that. So just explaining that sort of thing to them.
Now, do you do that test for every patient that comes in to CareMC?
When I was talking to Debbie the other day, we don't routinely do it for all patients, was my understanding. I think it's just high-risk patients.
And who's considered a high risk?
It would be, I'd have to look at their criteria specifically, but normally it's like if they have a history of it in the past, or if they come from, let's say, another hospital or a skilled nursing facility or a nursing home.
That might have an issue, so you check.
Yeah.
Are you sure? Okay, so there aren't specific diseases that lend themselves more to MRSA? Or to staph infections? I may be off again on the...
Oh, it's okay. I mean, if you think of where staph is located, it's on your skin. So if you were to have like a cellulitis, meaning like a skin infection, I mean, it most likely will be some sort of either staph or strep. So it could be MRSA in those cases. Also, patients who have indwelling catheters. So let's say if they have ports for chemotherapy or if they're dialysis patients and they have a fistula, anything where you will be penetrating the skin could put you at higher risk for MRSA.
That makes sense. Okay, well, we'll talk a little bit more about that in a minute. We're going to take a quick break. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Dana Bowers, who's an infectious diseases pharmacist here at KRMC. I'll get that right eventually. Dana, I appreciate you being on the show today because this is a whole new thing at KRMC, as we mentioned before the break, that we've never had someone with your skill set or even anybody looking at things in the hospital the way you are. We've got a whole new set of eyes, literally. So you're based out of pharmacy, and I know that our pharmacy here at KRMC is inpatient only. Right. So someone can't just walk in off the street and say, here's my script, can you fill it for me? Like they do at CVS or Walgreens.
Correct. We only fill prescriptions for patients who are hospitalized.
Okay. Now, can you also fill scripts for them when they go home, as they're getting ready for discharge?
We don't do that.
Okay,
no.
so they get scripts for that and take it to their pharmacist.
Correct,
after that. Okay. So people that are just at home watching the show and if you're going, well, the last thing I want to do is get an infectious disease. And I know we talked about this a little bit during the earlier part of the show, but what is the best way that I, as a person, can avoid getting any of these kind of yucky infectious diseases?
I'll just say take care of yourself, you know, get lots of rest. Wash your hands is the most important thing. Cover your cough, don't touch your face, and try to avoid people who are sick too.
Yeah, that's a good thing. And if you do get sick, stay home, not spread it, right?
Correct, correct.
I know in my staff, that's our pet peeve is, hanging out with someone who's coughing and sneezing, and you're like, really? Please go home. Don't share that with me.
Yeah.
And that's just like with colds and flu, but obviously other illnesses and diseases can be spread the same way. What other kinds, is MRSA and staph infection kind of your major push, or are there other infectious diseases you look at?
There's other infectious diseases that we're looking at in the hospital, but there's not really a good way to avoid getting those. People, for example, there's Klebsiella pneumoniae.
No, I shouldn't have asked.
I could go on and on. But basically, there's no real good way to prevent those besides what we already talked about. So certain patients are already at risk for things. So that say they're immunosuppressed, meaning
like if they've got cancer.
Yeah, or if they've had a transplant and they're taking some sort of medications that suppresses their immune system. So those patients are already at risk for certain things. So we just tell them to do the same types of things to avoid infections, but they're already going to be at risk to get certain ones.
So does things like wearing a mask, I see people frequently wearing a mask. Does that help them keep from getting that?
I would say, if someone's coughing around you and you're wearing a mask, it's better than, you're probably more protected than if you weren't wearing the mask. Yeah.
So if you've got that lower immune system, obviously it's just doing everything you can to avoid being around people who might be sick.
Yeah, and especially now since people are traveling, airplanes are really dirty. So if you, just like the handrails, the trays, I always bring some hand sanitizer with me and kind of wipe it down as soon as I sit down.
I think someone with your background has got to be, Debbie and I have had that conversation too. It's like the more you know about the bugs and stuff that are out there, the more you're like, oh.
Right.
It'd be really hard.
And the other thing that I can mention is if someone is in the hospital, we do stress good hand hygiene at the hospital, meaning that, the nurses between patients are supposed to use the hand sanitizing gel or wash their hands. But as a patient, it's always good to ask the nurse, did you wash your hands?
Yep, and the doctor too, right?
Right, ask anyone that's going to be touching any part of your body and examining you if they've washed your hands. And, that shouldn't offend them. They understand that good hand hygiene is important.
Taking responsibility for your own health.
Right.
It's important. I think sometimes patients, of course, have healthcare providers up on a little bit of a pedestal and they don't realize they're empowered to take care of and ask those kind of questions.
Exactly.
It's important that they ask those questions. And like you said, they shouldn't be offended by being asked. And Debbie and I have talked on the show before too, that's not every nurse or doctor necessarily uses the sink in the room to wash their hands, because they don't realize outside of each room they have those pumps with the antibacterials, so they could be doing that. But it's
Right.
still okay to ask.
Yeah, just ask. I mean,
Yeah.
it's not going to hurt anything
No.
if you ask. I mean,
Yeah.
it can hurt you if you don't ask.
Right.
So don't
Well,
be
and
afraid
it's
and just
hopefully
ask.
family members who question you about that, you're going to educate them, and they'll go home and be healthier also.
Yeah,
right?
hopefully.
So the whole infectious disease as well, you talked about that one you rattled off so easily. I'm amazed. Of course, how many years of school did it take for you to be able to say those words?
A lot.
Yes. So what other kind of things are there that are infectious? I mean, is TB considered
Yes.
an infectious disease?
So TB is. It's very prevalent throughout the world, not so much here in the United States, but other parts of the world. TB
So
is
if you're traveling,
is a huge problem.
okay. Is whooping cough an infectious disease? Because I know that that's been in the news lately
Right.
across the world, and, even in the U.S.
Right, and so that also is vaccine preventable too. So it's the diphtheria component of the Tdap.
That they're supposed to get when you're a baby, right?
You get that as a baby, and you get that as an adult too, as your
Okay.
booster.
Okay.
So you just need another booster of that as an adult to provide you some protection against that.
Right, and I know that our OB unit is doing a lot to educate new parents about the importance of them, and I think we're even offering that to them for free.
Right,
Because
so
it's better that they get that booster shot and not pass or run the risk of giving it to the baby.
And so the women, of course, are offered it after they deliver, and then the fathers are offered it for free.
Right.
Yeah, so that's awesome that we're able to do that.
Absolutely. Well, in the long run, Brian Turney and I have had many discussions, like our free flu shot clinics that we do and stuff like that. In the long run, it saves us money.
Yes.
Yes. It sounds kind of like, but it's true, because the more people we keep healthy or lessen their degree of sickness, the better it is for our community. And even though we are in the business of treating sick people, we really would rather see them out at Walmart and Safeway than in the hospital. The fewer the better. It really is good. So have you had a chance, I'm going to switch gears real quick here, since you are new to Kingman, and have you had a chance to get out and explore our community much yet?
Yeah, we're actually going to go camping this weekend,
very
which
good.
we'll see how that is, because
Yeah,
it's supposed to be really
winter's coming,
cold.
or here, yeah. So
Yes.
where kind of places do you like to go camping?
Well, we're going to go up to the Wallapies this
Oh,
weekend.
very good. There's some fun campgrounds
Yeah,
up
we're
there.
going to rent some cabins
Oh, good.
and do that.
Yeah, and the Wallapies are one of my favorite places, because in the summer you can go up and cool off, and in the winter, if you are getting a withdrawal for snow, you can go up there and play in the snow, make a snowman, and then come back down and be out of it.
Yeah.
That's my idea of a perfect winter, where you can leave it just that quickly. So it's great that you and your husband, how's he doing? Because I know residents, especially in the ER, they're put in a lot of hours.
Yeah, he's been really busy,
Yeah.
but he really wanted to come here. This
That's
was
awesome.
one of his top choices
Oh,
to come
great.
here, because he did a rotation here as a student.
Okay.
So he spent a month here last November, and he just
Okay.
really liked it. He really liked, the director of the program, all the residents. He liked the location.
Excellent.
And so we're just so happy to be
Well,
here.
and our ER department, from what I understand, sees a broad range because of where we sit on the
Yeah.
freeway. So, it's sad but true that we have a lot of accidents,
Yeah.
vehicle accidents from that, or people that are traveling that can come through, again, with weird things.
Yeah, it's been really interesting for him just because of the types of patients that he
Yeah,
sees.
the whole gamut.
Yeah, he's been having a great time.
Well, that's good. I mean, yeah, it is good that we keep them busy, I guess.
Yeah.
So now are your families back in Washington?
Yes, so both of our families live in
Oh,
Washington.
okay. So that's not too far away. You'll be able to get home once in a while if you get
Yeah.
some time off, if we let you off.
Yeah, it's not too far. So it's good
That's
that they're
really
close.
good.
It's a lot closer than when I lived in Texas.
That's
so.
true. That's true. It is kind of just a straight shot up there now, so not so bad. Now, are they on the ocean side?
So
Or
some
the-
of my husband's family lives on the west side, so the
Okay.
coast, but the majority of my parents' family lives on eastern Washington.
Okay, so
Yeah.
you do they're used to more of the snow and cold too then.
Yeah.
Yeah, very good. Well, they can come here too.
Yeah.
Because we'll be warmer probably, even in the midst of our winter.
Yeah.
Dana, thank you for being on the show today. I think we've probably taught folks quite a bit. And remember, wash your hands, cover your mouth, don't hang around sick people. All right, thank you for joining us. We'll see you again next week with another exciting guest on the program.